I will do this one, okay, and we'll record it. To get my stuff, record, put it on the cloud, and then share screen. This is the slide, and then the second one will be, I didn't open the second one. Let's open the second one. So here's the second one open. Okay. Yeah. So here, and go here to the Zoom, share screen. This is the one that you need to start with, right? Okay. This one? Yes. Okay, sure. And do it in show slide show right there. Yeah, it's fine. That would be good with you. Yeah, but when we change it, you're gonna see it this way. Yeah, that's fine. Now and you can click here if that one, so you use this. Okay, this one right here. This one too. Hold it up back into the first one, the second. Like this? Okay. Okay. Back to this one. That's okay. بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله صلى الله عليه وعلى آله وصحبه وسلم تسليما كثيرا. Welcome to the first part of the medical topics that is in connection with the Da'wah program and with the Women Committee. The Women Committee approved for a grant that we should spend for healthcare issues. Alhamdulillah. So the first program tonight is with my beloved brother, Dr. Sameh Mobarek. Dr. Sameh is a cardiologist and he's in UNC system, mashallah. And I claim that he is the best cardiologist in the city. May Allah subhanahu wa ta'ala grant him the all the piety and taqwa. Alhamdulillah Rabbil Alameen. Dr. Sameh also he's a dear brothers of mine. We've been in halaqa together for almost 15-20 years, but something like that. Alhamdulillah Rabbil Alameen. I am old, he's the youngest man. Yes. And Dr. Sameh also is on the board of trustees of Alnoor Islamic Center. So he's one of the board members, 5 board members, and he is one of the initiators of this masjid. Alhamdulillah Rabbil Alameen. Allah subhanahu wa ta'ala accept from him. Alhamdulillah. With that, I will leave you with Dr. Sameh. Those who are on the Zoom meeting, you can send your questions through the chat, and I will give it to the Dr. Sameh, inshallah. Feel free to ask after he finishes, inshallah. Leave that here, Doctor, and use that.
أعوذ بالله من الشيطان الرجيم والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. اللهم لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. Tonight I was given the task to talk about the heart, and as obviously as you can probably tell, this is one of my fascinating organs in the body. I claim to be the most fascinating organ in the whole body. And I'm going to tell you in a few why, not only from the scientific side of view, but also spiritually as well. In the world, there are 4 types of human beings that living. And this is no matter where you go, no matter what century you live in. The people who worship nothing in this world. This could be the atheists, of course, in this our time. The people who worship God, but have the associate somebody else with God, whatever that would be, which is a shirk. The people who believe in God, but don't practice. And unfortunately, even in our community, in our world, Islamic world, we have quite a few of those. And the people who worship God alone, they are focused, they are balanced people. They live between their own daily life, but it's still they strive for the hereafter. Allah subhanahu wa ta'ala has mentioned the heart in the Quran several times. And he says in Surah Al-Taghabun, ما أصاب من مصيبة إلا بإذن الله ومن يؤمن بالله يهدي قلبه والله بكل شيء عليم. Nothing happens to you except in accordance with God's will. Anyone who believes in God, He will guide his heart. He didn't say his brain. God is fully aware of all things. He also says in Surah Al-Anfal, verse 24, يا أيها الذين آمنوا استجيبوا لله والرسول إذا دعاكم لما يحييكم واعلموا أن الله يحول بين المرء وقلبه وأنه إليه تحشرون. And know that God intervenes between the human and his heart, and that to him you are gathered. Once again, he didn't say he's a brain, he says a heart. He also again said in Surah Al-Anfal, verse 12, إذ يوحي ربك إلى الملائكة أني معكم فثبتوا الذين آمنوا سألقي في قلوب الذين كفروا الرعب فاضربوا فوق الأعناق واضربوا منهم كل بنان. Recall that your Lord inspired the angels. I am with you to support those who believed. I will throw terror into the heart of those who disbelieve. So again, there's a lot of these examples in the Quran. When we take the word qalb and translate it into English from as a version of the Quran, the word qalb has been translated actually in the English translation or transliteration into mind or thought or innermost. Didn't say it's a heart. But in Arabic, the true meaning of the word qalb is actually the heart. The word aql is the translation for mind or brain. So in order to be close to God, we should think with our hearts, not with our brains. Allah subhanahu wa ta'ala clearly said that in Surah Al-Hajj, verse 46. أَفَلَمْ يَسِيرُوا فِي الْأَرْضِ فَتَكُونَ لَهُمْ قُلُوبٌ يَعْقِلُونَ بِهَا قُلُوبٌ يَعْقِلُونَ بِهَا أَوْ آذَانٌ يَسْمَعُونَ بِهَا فَإِنَّهَا لَا تَعْمَى الْأَبْصَارُ وَلَكِنْ تَعْمَى الْقُلُوبُ الَّتِي فِي الصُّدُورِ. Didn't they roam the earth? Then use their hearts to understand and use their ears to hear. Indeed, the real blindness is not the blindness of the eyes, but the blindness of the heart inside the chest. Our daily life is a rat race, and we all know that. We're living always in the fast lane, especially when we come to the developed countries like the country like we live in. And we tend to use our brains. We rush to use our brains. We never stop and rely on our hearts and think about our heart, because it just is the quickest way to reach any solution. We're lazy to use our heart or think with our heart. We tend to forget about that. Words comes out of our mouth wrongly. We get an argument, we get in a fight, and we hurt other people as well. This is when we need to stop and we think about that. That's why Allah subhanahu wa ta'ala said في سورة آل عمران وَلَوْ كُنْتَ فَضًّا غَلِيظَ الْقَلْبِ لَانْفَضُّوا مِنْ حَوْلِكَ. Have you been harsh and mean-hearted? They have abandoned you. So God was telling the Prophet ﷺ to have a soft heart toward these people who have not really submitted. In the Quran, the word heart was mentioned 132 times. So it's a very common word that is used in the Quran. And the studies have shown that the heart is the first muscle that's completed in the fetus of the heart. And the heart actually starts beating 25 days after conception. So it's just way early for the heart. And when you think about the heart is located in the left side of the chest. We all know that. And a lot of these scholars think that even when everything in this world should be directed toward the heart. For example, the very famous thing we write in Arabic. How we write in Arabic? Write from right to left. Everything is directed to the left. If you have the chance and opportunity to go to the Hajj, when you do the tawaf, when you do the circumambulation, which side did you face the Kaaba? left side, the left. You go with your left and you do the circulation always with the left side, look towards the Kaaba. Everything leading to the heart and that side. The heart is an amazing because it's a constantly working muscle. It's the only constantly working muscle. It does never tire. It beats 100,000 times per day. It pushes 2 gallons every minute and 100 gallons of hour every hour. 100 gallons of water. Now I would ask you, think about this. Try to move 100 gallons of water every hour. You would be so exhausted, you're probably not going to be able to finish it for the 24 hours. Yet, the heart tirelessly does that. We never ask the heart to do it. We just do it automatically and do it to the last breath that we have in this life. Not only that, the heart sends one of its main function among many functions of the heart, it pushes the blood out to the whole body. And it pushes that through pipes. And we call these pipes the vascular system, the arteries. And if you measure the length of all these arteries in your body, it is 60,000 miles of blood vessels circulating the blood around the body. What is 60,000 miles? That's more than 2 the circumferences around the whole earth. This is all just in the heart. So we just said that the heart starts to beat before the brain is even completely formed. So think about this. We all think that the brain controls everything, or is the center of the consciousness. Scientists for the longest time thought that really the brain is the center of the consciousness, is the intellect. But we learned that the heart actually beats and start working in the body even before the brain. One of the most interesting examples that we see is the heart transplant. When we do heart transplant, we take the heart recipient, the donor first, and we put it in the heart recipient. In order to do that, you have to cut all the blood vessels, all the nerves connected to the heart, and then transplant it into a recipient and do the same thing. You start connecting the blood vessels, but you really cannot connect the nerves because they're very fine. So the heart has no innervation, has no nerve supply when you transplant it into the body. And yet, it keeps beating. It might keep slowly beating, but it eventually would keep beating for the majority of the patients who get the heart transplant. We learned that this teaches that the heart can beat tirelessly, even without connection to the brain. But yet, we also discovered that the heart has over 20,000, some people say even higher, neurons, nerve supply, that connect the heart with the brain in a normal fashion. When we track these nerves, we found that it goes to certain part of the brain. Some of them are called the amygdala, some of them is called the thalamus, the cortex, neurocortex. And when the scientists looked into the function of these brain centers, it's the learning, it's the emotion, and now we have connection. Now we know that the heart cannot live without the brain, and the brain cannot live without the heart. There is two-way communication.
Assalamu alaikum. The voice is not clear. If you can make it clearer.
Sorry for the delay. Technology. Just okay. Yes.
Move into we know how the importance the heart is. And the question now is, how can we go about it to preserve it, at least from the health standpoint? So what is the heart in these examples? We talked about the heart pumps all this 4 to 5 liters. That's what we call cardiac output every minute. Just during a rest, if you try to exercise, you can double, triple that. And with effortlessly in order to meet the demand of the body that needs more. Of course, the heart push all this oxygen, all these nutrients to all part of the body, including in itself. So the heart itself has a blood supply and has a blood drain, just like in your organs. And the blood supply to the heart is our coronary arteries. The coronary arteries are 3 coronary arteries that actually sits on the top of the heart, one in the front, one in the back, one in the right, and these 3 major heart arteries with all its branches supply constantly the blood with its own heart. What's happening with the phenomena of hardening of the arteries, as the layperson would call it, or atherosclerosis, that deposits of plaque, deposits of fat, of cholesterol, of clots that form within the wall of the artery itself. And as this plaque starts to build more and more and more, it starts impeding on the blood flow. And this process, we call it atherosclerosis, which is leading eventually to a chest pain, heart attack, or whatever the manifestation would be. There's a lot of misconception that the heart attack happened only in old people or in old age. That's wrong. When we actually take a specimen of the major arteries, like the aorta, for example, from the body, and we look at 10 years of age, we found that plaque is already started at 10 years of age. And it's a slow process over time. That's why a heart attack doesn't happen just today. It's going to build up of this plaque for many, many, many years. It's a slow process. But just know for a fact that this is started from a very early age. And this plaque, this cholesterol-rich plaque, or buildup of cholesterol is not only buildup in the heart. Just imagine any artery in the body, it can do the same thing. So if it develop in the brain, it causes stroke. If it develop in the peripheral arteries in your legs, for example, you walk, you get claudication, we call it pain, you rest, it goes away, so it can affect the leg arteries. Of course, it can affect the heart with chest pain, heart attack, or die suddenly. It can manifest in any organs of the body. The manifestation of heart disease, it can vary. You can have no symptoms whatsoever for a long period of time. And it was discovered incidentally. You're going for maybe for a checkup, something funny about the pacemaker, maybe your cholesterol high, maybe you have risk factors, maybe you tell the doctor, you know what, I have a lot of family members that have a heart disease. So it's decided maybe to perform a stress test, and bang, the stress test was abnormal. It led to catheterization. I'm telling you, I've seen this example. All 3 blood vessels are blocked. Patients end up by a bypass surgery, never have chest pain. So this can exist. That happens maybe luckily in only a small group of patients, maybe only 10%. The most common manifestation is chest pain. And we just have a common saying is that any pain above the belly button, it can be a cardiac pain. So it could be the chest, it could be the arms, right to left, it could be the jaw, it could be the shoulder, it could be between your shoulder blade, it could be the upper part of the stomach. Any of these basically can be a manifestation of heart disease. But the classic one is that you do some sort of an exertion, some activities, you get chest pain, it rests, it goes away. When we hear that story, it's the most plausible, good story for cardiac pain until proved otherwise. The manifestation of the buildup of a plaque or blockages in the heart arteries could be a heart attack, it could be chest pain, or it could be the first and last time manifestation, meaning die suddenly. So the manifestation varies, and we don't know why a patient would have no symptoms, why a patient would have very mild, vague chest pain, why a certain patient would have a classic chest pain, and why somebody for the first time developed heart attack, led into life-threatening rhythm, took his life within a few seconds, no matter what we did. So this is a different manifestation of the same thing. What we know also that any buildup of a plaque of an artery, imagine this artery is a tube, a pipe. This pipe has to be built inside of it, a plaque. That plaque has to reach at least 70% or more to compromise the diameter of this artery. So say, for example, I took anyone and we did an angiogram, catheterization, we injected dye into the heart arteries to figure out if that patient has any blockages. And I walked out and I told the patient, guess what? You have 10, 20 blockages. All of them, 20%, 30%, 50%. We do nothing about those. Because this is not meet the threshold, doesn't cause symptoms. You just need to control the patient's risk factors with high blood pressure, diabetes, smoking, and so on and so forth. So for an artery to develop, coronary artery, for the patient to develop manifestation of it, that diameter of the artery has to be compromised at least 70% or more to result in manifestation of the disease, symptoms, and for us to work on it or do something about it. Heart disease, despite all what we did, is still #1 killer, not in the United States, not back home, it's a nationwide, it's worldwide. 12 million die annually worldwide of heart disease. However, within the last maybe 3 decades or so, we've seen some decline, and that significantly declined in the developed countries. Because some have some understanding, the smoking and so on, so in prevention, the control of diabetes, maybe better health care. But unfortunately, we see this on the opposite side in the developing countries, or maybe back home, it's actually on the rise. We've seen people pick up the smoke at a younger age, females as well, male as well, and we see this problem bigger and bigger and bigger and bigger. Now, what makes a person predisposed to heart disease? One of them is your genes, maybe a poor eating habits, diabetes, high blood pressure, smoking, and so on and so forth. This is all known risk factors. We've seen this more and more in our lifestyle. We've seen it at a younger and younger age because of that. Now, there's things that you can do to change that, and there are things you cannot do anything about. So what you cannot do is, we know that heart disease happen at about, for men, at least 45 years and above, for women, 55 and above. So the women typically, to manifest with coronary heart disease, lag 10 years behind men in general. But once they reach the menopause, men and women are at the same rate of coronary heart disease. 6, we know the male, I guess, until the age, again, of 55 or 60 at a higher risk, and then both of them at the same risk. Race, there are certain race that has maybe high risk, and actually a certain race has low risk. For example, in India, there are certain risk factors that make them more develop diabetes. They have low HDL, low good cholesterol, LP little a is high. It's a certain factor of cholesterol that make them more predisposed. At the same time, there are very small, certain area in the world, a small Italian village, when they went to it, people don't die of heart disease. And they looked into this and why they do that, why they have it. And look, they have certain cholesterol parameters, certain risk factors, have a very, very high HDL, good cholesterol, and they don't die of heart disease. So it just, again, this race has some factor in it. Family history as well. These things you cannot do. You cannot change your age, you cannot change your family, you cannot change your sex, you cannot change your race. But you can do something about if your cholesterol is high, if you smoke, if you have high blood pressure, if you have diabetes, if you're overweight. All these are important risk factors that's modifiable. You can do something about it. So again, we talked about the cholesterol. Too much is not good. And basically that these cholesterol deposits in the arteries, and especially at the bifurcation, when the arteries started to branches out, it's very common when the blood starts to slow. This is when the cholesterol get deposited in this area and cause the heart attack. Cholesterol comes from 2 ways in our body. About 1/3 comes from everything you put in your mouth, and 2/3 from the liver. The liver has the ability, has its own receptors, has own manufactured cholesterol. You have no hand in that. What you have hand in is the 30 or 35% of what you eat in your mouth. That's why when we try to do a low cholesterol diet, to watch what your cholesterol is in your diet, you can affect the cholesterol, yes, by about 1/3. You can lower about 1/3. That's not a small number, but it doesn't eliminate the whole cholesterol. That's why sometimes, occasionally, we see a marathon runners that unfortunately inherited that high cholesterol from their families, and they're coming with a heart attack. A marathon runner? Yeah, just because this high cholesterol, they do everything they can do. Yes, they have maybe a presentation later on in life, but this is something that they have to pay attention to and maybe have to receive more than just the exercise, maybe the cholesterol medications for that. And we also just mentioned about the good cholesterol and the bad cholesterol. Obviously, your bad cholesterol, LDL, the less of it you have, the better you are. The more of a good cholesterol, that's your HDL, the more of it you have, the better you are. And exercise typically is the best thing to increase your HDL, your good cholesterol. It is much, much, much easier to lower LDL by whatever means, exercise or mostly by the medication as well, than to raise the good cholesterol. Raising the good cholesterol is a much harder task than that, than lowering the bad cholesterol. Overweight, obesity is a big epidemic in the whole world, not just in the States. Just being obese increases the risk by 2 to 6 times the risk of developing any heart disease. And we know that the normal waist to hip ratio is important. And we talked about pears. We will talk about pears and apples. Let me explain that to you. Apple shave are a higher risk. Pear shave is a less risk. What does that mean? That means if you have a body, your body store the fat in this area around the abdomen and about the chest, that's an apple shave. That's a higher risk for heart disease. That's more than a pear shave, which is more in the lower part, from the thigh down. So the more this area is accumulating the fat, know for a fact that this is a more risk of a heart disease. Exercise is very important. Every morning my brain tells me to exercise and my body laughs at the idea. So this is something we have also to carry on. The people that smoke, has many adverse effects. Increase the blood pressure is one of the most devastating things that lower the HDL. It damages the blood vessels. Of course, it causes the heart attack incidents. And of course, the claim is that is it the smoking, is it the chemical inside it? Well, we know for a fact that at least 200 chemicals inside the cigarette smoke that are poisonous, and not only cause the heart disease, but it causes a multitude of things, and one of them is, of course, is the cancer. If you think that you are smoking the cigarette, you're mistaken. It's the other way. It's actually the cigarette is smoking you. Diabetes also is a very important. Diabetes, even if you have normal cholesterol, your risk of heart attack or coronary disease is 2 to 3 times of a person that does not have diabetes. 80% of diabetics, the number one cause of death is a heart disease, whatever the heart disease is. It could be congestive heart failure, could be coronary artery disease, and even the risk of sudden death with diabetic is higher. So diabetes, no matter how you look at them, always at a higher risk of developing any coronary disease or congestive heart failure. Of course, the more risk factor of these, the more you accumulate some of those. If you have high blood pressure, high cholesterol, diabetes, and so on and so forth, the risk keeps multiplying and multiplying. The more risk factors you add, the more the higher risk. So even if you have a little bit of a cholesterol and maybe a little bit of diabetes and a high blood pressure, but you have these 3 or 4 things together, that's again raise the risk for heart disease as opposed to having one isolated risk factor. Misfortune always comes in by the door that has been left open for them. So don't leave the door open for these misfortunes, because we need to get under control. Sorry. Yeah. So when it comes to us, we always think about our bodies the last thing. So when it comes to my car, I wanted the best mechanic to fix it. But when it comes to my own body, I can call my friend, I can call my neighbor, I might go to the pharmacist like back home, I can call any of us, and I listen to their advice. But that's really not the right way of doing things, correct? We hear all this from all different, from within the community, from outside the community. I never have any test or retest. I never been to a doctor. I hate doctors. I never take medication. I'm not going to take any medication. They're poison. My blood pressure is normal today, and I used to take blood pressure for the last 2 months, so I'm not going to stop I'm not going to take the blood pressure medications anymore. Same thing for cholesterol medication. Same thing for diabetes medications. I'm my own doctors. I no fees too. I don't have to pay any fees for the doctor. We hear all kind of stories about escaping the opportunity to improve my body or help self. So always look at your eat. And one of the most important things that we drive the patient home to is your diet has to have a lot of fruits and vegetables every day. Ideally, 5 servings, and ideally, the kind of fruits or vegetable that have low caloric index. Variety of grain products, non-fat, low-fat products, and we have the opportunity and the luxury to look at the ingredients and know all these nowadays. If you go back 50 years, with nothing that was that exist at that time. Intake of food, portion is always what hurt us. The number of calories that we eat is not more than anything else. If we can eat everything we want, but if we just control the portion, well, that would be very, very fortunate thing that we can do. Saturated fat, saturated fat and cholesterol. For all these, we have to learn that. For people that have high blood pressure, definitely no more than 5 or 6 or even lower gram of salt a day. The average American diet has at least 7-8 grams a day of salt. Food that is rich in cholesterol and saturated fat, meaning the food that you should avoid. Again, this is when you do it especially in excessive. Egg yolk, fatty meat, organ meat, the liver, the buttered chicken, the battered fried fish, the milk fat, all these, the cookies, the biscuits, the patties, the cakes, the pastries, all these have a processed sugar and saturated fat. So try to avoid as much as you can of these. There's actually myth about some of the oils that has increased the cholesterol. We should avoid coconut oil, palm oil. Monosaturated fat is more healthy to the heart, like olive oil, groundnut oil, canola oil, mustard oil. Also the polyunsaturated fat, this is even better. The sunflower, the soybean, this is also a different point. Omega-3 fatty acids, fish oil is very also healthy. And you can rotate these. You can use them. You don't have to use olive oil all the time. You can rotate these beneficial oils in your diet. Exercise, we talked about this. It is very important to maintain some sort of an exercise program, especially for people that maybe don't have the time. They have much time on their hands. Maybe after retirement, maybe early in the morning, maybe after you come back from work. But just try to dedicate at least some time of your time for exercise. It helps to reduce the weight, increase your HDL, reduce the LDL. It helps the high blood pressure, it helps the diabetes. We know for a fact that exercise lower the incidence of diabetes, lower among the incidence of high blood pressure. For people that walk more than 2 miles every day, their mortality is halved. This is just simple things that are for person. And we're not talking about a fancy exercise. We're talking about, peloton, bike, or anything. We're talking about just a good pace, brisk pace walking. That's all what it takes for that. So can you reduce your blood pressure as much as 20 millimeter mercury? So whenever any exercise trial that you look into it helps the body in one way or more. So how much exercise we're talking about? Ideally, 30 to 45 minutes for ideally 4 or 5 times a week. Not necessarily every day, but maybe 30 to 45. And again, we're talking about not any kind of fancy exercise, just walk. You don't need a gym. You don't need an expensive bike or any of that kind of things. Just a simple walking. Smoking, thank God, majority of us don't. But once you stop smoking, within 24 hours of quitting it, your heart attack start to decrease. And then within 2 years, after quitting smoking, your risk for heart disease is no different from somebody that didn't smoke. That is completely opposite to the lung. The lung cancer, the lung never forgets that you smoke. So once a person smokes, especially for many years, especially heavy smoker, a lung always at a risk of developing cancer down the road. So this is when you quit smoking, when you adopt a healthy diet, when you exercise, with all these risk factors, you can improve all this, not just the heart. You lower the incidence of diabetes, high blood pressure, cancer, the bronchitis and chronic respiratory asthma, your bone health, your oral mouth health, and mental health. All this has a very beneficial effect if we just adopt this healthy lifestyle. And then lastly, know your number, know your number, know your number. This is very important, and that's not your mobile number. Meaning that when you go to the doctor, you measure your cholesterol, you know your total cholesterol has to be less than 200, your LDL, your bad cholesterol less than 100, your HDL, good cholesterol more than 40, your triglycerides is an old slide, less than 150. So get these tests done routinely, know it's your numbers, and importantly, really it's the only thing worse than finding out that you have one of these conditions is not finding out what you have, okay? For every 10% reduction in the blood cholesterol, it reduces your heart disease by 20 to 30%. So this is important. And anybody above the age of 20 will start to look at the cholesterol because of the epidemic that it's happening. We're seeing more and more diabetes, more and more heart disease, more and more high blood pressure in a younger individual compared to before. Controlling your blood pressure, we talked about exercise, diet, and salt. The optimal blood pressure also has changed for the last few years. It's now the optimal blood pressure is 130/80, and that's what the goal that we're for. We need for blood sugar, your fasting blood sugar less than 100, and after postprandial or after meal less than 140. Again, when you look at it, it's the same thing: diet, exercise, and look at what you eat. So this is the things that we need really to pay attention to, that you eat healthy, you walk regularly, you watch your weight, you quit smoking immediately, you keep your weight under control, and you take your medicine. Don't wait for a heart attack to take an action. Don't wait for a second life. We are not cats. I'll stop here and entertain any questions.
And I will apologize for those who are online. I know that you have problem hearing us. And this is a benefit that you come to the masjid, inshallah, and listen to us here, inshallah, Rabbil Alameen. And we first will open the floor for those who are here, inshallah, if you have any questions. So Dr. Sameh talked about so many things that's important to our heart, to keep our hearts healthy, that first stop eating completely, right? Don't eat anything. We have provided you healthy refreshment tonight, and that's another benefit for those who are online. You can come and enjoy the refreshment, and I think they eat in moderation, that as Allah subhanahu wa ta'ala mentioned, "Kulu washrabu wa la tusrifu." That's very important. The second important thing that Dr. Sameh has stressed on is the activity. That you have to walk, you have to have something other than work. Don't tell me that you are walking at work. Working at work will not count, because that's your regular activity and the system will get used to it. You have to get your heart beyond the regular activity. That's like walking, different than the time to walk physically. Get your training suit and your sneakers, and go do it 30 to 45 minutes at least a day, 4 to 5 times a week, inshallah. May Allah subhanahu wa ta'ala protect you and protect your heart, and all of us, inshallah. Let me check the chat here, Doctor, and see if we have some questions, and we'll get that to you. All the chat about the voice is not clear. So sorry for that. We recorded the session and you will have it. You have a chance to review it, inshallah, online after we finish, inshallah Rabbil Alameen. And sorry for that. Next time, come and join us in the masjid. Jazakumullah khair. You can unmute yourself and if you need to ask questions, inshallah. First, anybody here questions? Bismillah. Can you hand the mic? No, get the wireless mic, maybe. Fast, run. We'll get you the mic, inshallah. Get ready with your questions, inshallah. It's a very important topic that we take care of our hearts, the good heart and the spiritual heart as well. Now the voice is so clear. MashaAllah, Alhamdulillah Rabbil Alameen. Alhamdulillah. If you like to ask questions, anyone online, unmute yourself and or raise your hand. I don't know how to. If you don't know how to raise your hand, you need to learn that. Bismillah, sister. I would ask you to repeat the question so they can hear.
The question from a sister is about what about the keto diet effect on cholesterol? And that's really very valuable. Keto diet has been studied, well studied actually, and there's several articles on it in the literature. And what we've seen that in, I would say at least 75% of the people, for the patients that adopted keto diet, keto diet has been studied, only was done for a short period of time. We're talking about 3 months, 6 months, maybe maximum a year. Not most of the studies has not adopted at that. In itself, the keto diet should not be carried out more than 6 months because unless you have to be very careful of a state we call ketosis. When you start breaking down other parts of the body in order to meet the demands. And you go into the state of ketosis. So the keto diet is meant to jog up the weight loss, to give you that push for the weight loss. But it's not advisable to carry it for a long period of time. If it's going to be carried for a long time, it can be done in 2 ways. You gradually introduce the other food items gradually, or to do it intermittently. Meaning that you go for 6 months on it, then you go 6 months off, and so on and so forth. But continuous keto diet is not. Now, there are a group of patients, this is maybe 20-25% of these patients, and I've seen this patient, their cholesterol was maybe slightly elevated to start with, or maybe even normal. After they adopt the keto diet, their cholesterol went over 300. And we told them you have to stop. So again, for some patients, this phenomenon can happen, that the cholesterol gets sky high. So the bottom line is, if you wanted to adopt a keto diet, to lose the diet, it is fine, but it just you have to watch the cholesterol. What we're telling people nowadays, at least, well, not nowadays, for the last at least several years, is intermittent fasting, subhanAllah, is probably the best way to go.
The other question is related also to the heart in this case, with the heart transplant. But when studying the heart, literally when they say heart transplant, the purpose of the heart is just to pump blood. But then in the Quran it's a little bit different because Allah subhanahu wa ta'ala, judge you based on your heart. So when it comes to heart transplant, you did mention something about neurons in the heart.
Mm-hmm.
So if you're doing a heart transplant from one person to the other, with the person who's receiving the heart, say for example, if the person who's the donor
Mm-hmm.
has hatred towards somebody, with the person who's receiving the heart will have the same hatred towards that individual. Does that make sense? So for example, say I'm giving my heart, I have hatred towards person A. So I'm giving my heart away. The person who's receiving the heart, will he or she have the same hatred or love, etc.? Will they have the same feelings that when I have my heart? would this say the recipient would also have that same feelings?
Okay, so the question is that is the emotion get transported with the heart, with the physical heart during heart transplant procedure? That happened only in movies. In real life doesn't happen. As a matter of fact, what we also know that cutting all these nerves in order to do the physical transplant of a heart into another body, over time, what we learn, there is some regeneration of these neurons. It might not be complete, but there are some regeneration of the neurons. But for the emotion, no, there is no transplant of emotion. There's a transplant of a physical heart.
So, but in Quran, why I also want to emphasize more of the heart than it leads to emotion, it leads to understanding. So I'm trying to comprehend the need. When we talk about the heart, the purpose of the heart is to pump blood, especially when it comes to transplant. In the Quran, it does talk about the heart simply the center of the individual.
Yeah, it's actually it's the interplay between the heart and the mind and the brain. But still, the heart is the center of the intellect. If you want to say that what is the center of the intellect, everything goes back to the heart. Because just thinking with the mind alone, it can lead you into, many pathways, different pathways. But when you integrate into the heart, into the process, you can make a valid, rational, or reasoning for what you do. So the heart is still, no matter how you transplant it or not transplanted, the patient that gets heart transplant, they still have emotions. They still have decision that they make right or wrong. Now, whether how this physically happened, Allah subhanahu wa ta'ala knows best.
But it's not the emotion.
Jazakallah khair. Can we, I'm sorry, there are some questions online and we'll get back to you, inshallah. So can you read it or should I read it for you? Right, so the question is, what is considered the ideal diet for people who aren't necessarily struggling with any medical conditions, but are genetically more susceptible to the diabetes?
So I would say just, I think I mentioned just a few minutes ago that intermittent fasting, this is not just because we fast on Monday or Thursday. This is actually one of the studies from the NIH, National Institute of Health, that it was done over 10 years ago or so. And it was fascinating that they did every other day fasting. Of course, it's been done in maybe in a different way, that you still have liquid, but you are complete fasting. But if you know what is happening now, the intermittent fasting is done a different way, but usually is you don't eat maybe between 10 or 10:30, for example, and 6:30 p.m. or vice versa. So you have a short period of time, and that's what we do in fasting in a one way or another. This has been studied even before human beings. So it's been studied in human beings through the NIH. But even before that, many years before that, they studied in rats. And they studied in a different ways. They took two groups of rats. The first group of rats, they let them eat whatever they want. The second group, they did the every other day fast. They eat one day and then whatever they want, and then the following day, they completely restricted from any food. And they keep doing this, and they found that these rats actually live longer, the one that did the everyday other fast. They went even further and they said, okay, what about the effect of fasting on dementia? So we know there is a certain protein, it's called amyloid, that get deposited in the brain in patients that have dementia. So they actually artificially injected that amyloid in the brain of these rats. And this is another study. And you took the rat and then they repeat the same study, intermittent fasting, and subhanAllah, the rats that were subjected to intermittent fasting were more resistant to dementia, development dementia down the road. So again, intermittent fasting, I think, has a lot of scientific, now also psychological effects as well. So I'm an advocate of intermittent fasting based on these data that we have.
What is the definition of intermittent fasting? How you do it?
So again, there's really not, when you look into it, it's done in a different way. There is some people doing it every other day. There are some people that are doing it 3 days on, 4 days off. The conventional that is used in the state here, or what we heard about it, especially from NIH, that during the period of this fasting, you are taking maybe at 12 hours of the day that you're not eating at all, but you're drinking, and then the other you are eating,
Drinking water.
water, yeah, liquids, and then the other period of time that you're eating, but again, eating in a much healthier way. So that definitely has effect on not just the body weight, but also in other organs. Your our body, if you eat, I'm not a believer in 3 meals a day. Yeah, I don't believe it. But your body, in a constant, when you introduce food to it, it takes at least 4 hours in the stomach and then goes into the gut, and then it needs to be digested and all this. So if you eat 3 meals a day, and especially in between also snacks, your body is constantly trying to get rid of these waste products, get waste of restaurants. Once you give it a break, at 12 hours, whatever, that your bodies have a time to get rid of these waste products. It helped the gut, it helped the heart, it helped the skin, it helped the respiratory system, it helped the immune system, it helped the eyes. There's a lot of other organs that really can benefit, do benefit from the intermittent fasting.
So what is the intermittent fasting and Monday and Thursday fasting as a sunnah? What do you think?
I mean, it is a form of intermittent fasting. Definitely it is, and that's why I said Subhanallah, and it just this is circling back to the Sunnah.
Going back to the sister, inshallah. Bismillah.
This is going to be my last question.
Inshallah.
All right. So Allah subhanahu wa ta'ala mentioned the qalb, and he also mentioned the fu'ad. So what's the difference between both in like in medicine wise or physiological?
I don't think there's a difference in the qalb and fu'ad from the scientific standpoint. I don't think so.
Other reasons?
In my knowledge,
the physical heart.
The physical heart.
Well, yes.
So the qalb is a physical heart,
Right.
but also when you read the Quran, it also could be related to the mind and the thought process and the innermost, like we talked about it. The fu'ad is probably the spiritual one, but the word qalb itself, it's going back and forth, because that's what the heart does with the contraction and going back and forth with ideas and all this as well. So it both physically and spiritually as well.
Any other questions, inshallah? Bismillah.
Surgery.
How old is he?
My mom, he's 15.
Oh, okay.
Surgery gives me all of his work and another. So right now he's overweight. Do you recommend weight loss pills or is he allowed to take it later on in life? Especially the century weight loss pills. I know they're not supposed to take it, or you have to be at least 18 to take it. But since he has that issue and still have microholes that was not posed, but the doctor said that he can live with it, it may or may not pose, but he's not having more issues and he no longer see the cardiologist. Can he take country?
So the sister is asking about a 15 years old with a congenital heart disease, a hole in the heart, and for him not to see the cardiologist anymore, that means he's probably stable at that point in time and he can live normal life afterwards, which alhamdulillah is great. And now there's a matter of obesity or overweight, and should he take a weight loss medications? And you specifically mentioned the phentermine. The phentermine, again, just like the keto diet. For that example, a lot of physicians will frown on it because it has some side effects, and some of the effects that increase the heart rate. So if he's not really predisposed to any of that, it's fine. I do prescribe it in certain situations. I do not give it to patients for a long term. So again, it's like what it does, it decreases the appetite. It does not work for everybody either. So once you start it, and I usually start like a low dose, 37.5 milligram, really go over that. You can give 75 if the 37.5 does not do much. And I would not use it more than once a day. And I would give it only for 3 months first as a start trial and see, but it has to be done in parallel to the motivation. So I have to sense that the patient is really motivated for the weight loss. And then we stop it and see how it goes. If the patient continues to wait, maybe I'll give it another 3 months. I usually give it no longer than that. We know that the phentermine is part of the fen, if you remember that long time ago, that has an effect on the valve of the heart and effect on the blood pressure in the lung. So it can cause pulmonary hypertension. So long-term is discouraged. Short-term, again, just to give the boost for the weight loss, it may be fine.
But when can he start taking it? He's only 15 right now.
Yeah, I usually don't prescribe it unless it's 18 or so. But nowadays, I know there's some people that we can do it lower than that.
But other ideas for that keep them active, moving, and maybe stop the TV games and things, so that will be more activated. We have a lot of reporting for our children that increasing the weight in the children because of the use of games and staying home. And the doubled now by COVID-19 staying at home. So that we should have that ability as parents to get them out, do physical activity, not just everything that watch the TV. No, need to get out of the house, walk with them, and we need to get them really active, inshallah.
He's not an active person, but when he's really lazy, but he loves to walk. He can walk for hours, but he does not do anything to him.
Yeah, it has to be a combined, the dieting itself or the low calorie, caloric diet, and plus the exercise.
Sorry, one more thing.
Sure.
We also had an extra electricity on the heart. The white syndrome, something.
Well, Parkinson-White syndrome.
And he did the surgery for that as well. And alhamdulillah, it doesn't need to get cardiologist. So it's still okay. And he can lean on the right. Absolutely.
The ablation, he had an ablation, right? For the Wolff Parkinson-White is curative, meaning it's gone. It's gone forever. It doesn't come back.
Jazakallah khair. So we don't want to take too much time from Dr. Sameh. I know he is very, very busy. Jazakallah khair for coming and making that time with us, inshallah. And we will ask you to stay over for a few minutes if anyone can approach you and talk to you.
Absolutely.
That's fine, inshallah. So if you like to ask Dr. Sameh one-on-one, he is here before he leaves, inshallah Rabbil Alameen. Make sure to take some of the refreshment that we got today and be participant of that session. This session is supposed to be Friday. Yesterday was there is some kind of talking about snow, so we said that let's not to do it today. Dr. Sameh was very flexible to come, alhamdulillah. So, but next week will be Friday, inshallah. This week will be Friday, inshallah, after Aisha program. So we'll ask everybody to come and join, inshallah. I mean, we practice social distancing and mask and everything, inshallah. We'll ask Allah subhanahu wa ta'ala to protect all of you, bismillah rabbil alameen. And one questions, and I will let you go, was for Dr. Sameh to stress on the importance of vaccine. There are some of the community members that they are scared. They are not considering it when it's available, inshallah. So should we take it or not, Dr. Sameh?
No, I took my second dose today.
MashaAllah, alhamdulillah.
So please do.
So that's good enough, inshallah. That's good.